Before cleaning the restroom, make sure to do hand hygiene and put on the PPE you will need. When you are putting on your PPE, it is important that you put it on in the correct order. To don or put on your PPE, always start by performing hand hygiene. Next, put on your gown and tie it in place. If a gown is a piece of PPE, you will need to remain safe in the care environment. Next, put on your face mask. If this will be a piece of equipment you will need to remain safe in the care environment. Now, put on eye goggles. If this will be a piece of equipment you will need to remain safe in the care environment. Finally, put on gloves. You will always need to put on gloves and have protective eyewear ready to put on when you are using chemicals that could splash into your eyes. First, remove any trash in the restroom from the floor and the counters and place it in the trash can. Remove the liner from the trash can and place it in the trash liner at the doorway of the room. Next, remove any used linen in the restroom and place it in the linen hamper or bag. The next step is to high dust the room. Be sure to put on your protective eyewear so you do not get anything in your eyes. The goal of high dusting is to remove any dust, which may harbor germs, from any horizontal surface and give the highest level of cleaning for your patient or resident. You should high dust all areas above your shoulder using a high duster. If the patient is not being isolated, high dust surfaces above your shoulders such as air vents and the nearby ceiling tiles. If the patient or resident is being isolated because of having an infection, do damp high dusting. In another part of this training video, you will learn how to clean and disinfect high-touch surfaces. Those surfaces that have a high risk of transferring germs because they are touched by many people, many times throughout the day. For now, we will talk about how you will damp wipe all other surfaces in the restroom with a cleaning cloth and disinfectant. Surfaces that need to be damp wiped in the restroom are the walls, counters, ledges, the shower wall, and fixtures such as the shower head, shower faucet handle, shower grab bars, and the shower seat. The toilet and the area around it are the last to be cleaned in the restroom because these are the dirtiest. With the same cleaning cloth that you use to damp wipe surfaces, begin to damp wipe the toilet. Be sure that you wipe the seat, outside of the bowl, the chin, and right underneath it, wiping all the way to the back of the toilet. Place the used cleaning cloth in the container or bag on your cart. Put on your protective eyewear so that you do not get any chemicals splashed in your eyes while cleaning the toilet bowl. Using the toilet bowl cleaner, start to clean the toilet bowl. Once the toilet bowl has been cleaned, flush the toilet with the toilet brush or Johnny Mop in the toilet several times to rinse off any chemicals that might still be on it. Place the toilet brush or Johnny Mop in its holder as you leave the room. If the patient is being isolated because of having an infection, leave the toilet brush or Johnny Mop in its holder and leave it in the bathroom until the patient or resident is discharged. After cleaning the restroom, you need to remove your gloves, do hand hygiene, and put on new, clean gloves. A rule is that when your hands are not visibly dirty, alcohol-based hand rub is the best way for doing hand hygiene in the healthcare setting. But if your hands are visibly dirty, you must use soap and warm water to clean them. Now that the restroom is clean, it is time to restock the paper products and put a new trash liner in the restroom. Make sure to place a toilet strip on the seat if these are used in your facility where you work to signify the toilet has been cleaned. The next step is to dust mop the restroom. Start at the doorway and work your way along the edges of the room. Move the mop in a figure 8 motion, making sure the swipes of the mop overlap so you do not miss any area of the floor. Make sure to pay close attention to corners and edges for dust and debris that will build up there. The last step in cleaning the restroom is to damp mop the floor. To keep the environment safe and help prevent someone from slipping on the wet floor, always start by placing a wet floor sign at the doorway of the room. Be sure to wring the mop head to remove as much solution as you can to lessen drips. After you wring out your mop, or after you have put cleaning solution on a pre-dampened floor cleaner, if this is what is used where you work, start to mop the floor from the edge of the room and work towards the furthest corner of the room away from the door. Just like with dry mopping, you will mop using a figure 8 motion so that the swipes of the mop overlap each other and the whole floor is cleaned. Make sure to walk your way out of the room by damp mopping as you go, so you do not track dirt from your shoes onto the newly cleaned floor. Keep the wet floor sign in the doorway of the room until the floor is dry and it is safe to walk on.